Hello everyone, now let us discuss about 2023 ICD-10 coding guidelines for chapter 15 part 6. In the current session we will be focusing on alcohol, tobacco and drug use during the pregnancy, childbirth and puerperium. Next, the guidelines regarding poisoning, toxic effects, adverse effects and underdosing in a pregnant woman. And finally, abuse in a pregnant woman. Now coming to alcohol, tobacco and drug use during the pregnancy, childbirth and puerperium. It is again subcategorized into alcohol use during pregnancy, childbirth and puerperium, which is given by the code 099.31. This is further expandable. Next, drug use during pregnancy, childbirth and puerperium is given by the subcategory 099.32. And tobacco use during pregnancy, childbirth and puerperium is given by the subcategory 099.33. All these codes are further expandable based upon whether they are affecting pregnancy, childbirth or puerperium, and when they are affecting pregnancy, they are again categorized based on the trimester. Now coming to alcohol use during pregnancy, childbirth and puerperium. We know that the codes under the subcategory 099.31 alcohol use complicating pregnancy, childbirth and puerperium should be assigned for any pregnancy case when a patient uses alcohol during the pregnancy or postpartum. Whenever the patient uses alcohol during pregnancy or postpartum, you need to use the code 099.31 subcategory. And the secondary code from the category F10, alcohol related disorders, should also be assigned to identify the manifestations of the alcohol use. PDX should be 099.31 followed by SDX from F10 series in order to identify the manifestations of the alcohol use. Now coming to tobacco use during pregnancy, childbirth and puerperium. The codes from the subcategory 099.33 smoking complicating pregnancy, childbirth and puerperium should be assigned for any pregnancy case when a patient uses any type of tobacco product. When a patient uses any type of tobacco product during the pregnancy or postpartum, then PDX should be 099.33 followed by a secondary code from the category F17 which indicates nicotine dependence should also be assigned to identify the type of nicotine dependence. Next, drug use during pregnancy, childbirth and puerperium. The codes from the subcategory 099.32 33 for tobacco, 32 for drug use. 099.32 drug use complicating pregnancy, childbirth and puerperium should be assigned for any pregnancy case when a patient uses drugs during the pregnancy or postpartum. And this can involve illegal drugs or inappropriate use of abuse of prescription drugs. In either case, it is considered as drug use. It can be illegal drugs or inappropriate use or abuse of prescription drugs. And secondary codes from the subcategories F17 to F16 and F18 and F19 should also be assigned to identify the manifestation of drug use. So whether it is alcohol, tobacco or drug use, minimum of 2 codes are required. In fact, minimum of 3 codes are required in all the cases. One code to indicate the use of either alcohol, tobacco or drug. Second code to indicate the dependence, whether it is alcohol, tobacco or drug. And finally, weeks of gestation. So minimum of 3 codes are required whenever we are coding any pregnancy case that is complicated by drug use, tobacco use or alcohol use. Coming to the codes for alcohol use during pregnancy, childbirth and puerperium. The first code is 099.310. We know that 099.31 is used for alcohol use. And the 6th character 0 here. Either it can be alcohol, tobacco or drug use. The 6th character is common. So let us have a look. The 6th character 0 indicates unspecified trimester. 6th character 1 indicates first trimester. 2 indicates second trimester. 3 indicates third trimester. 4 indicates complicating childbirth. And 5 indicates complicating puerperium. Now coming to the codes for drug use during pregnancy, childbirth and puerperium. As we have discussed earlier, the sixth character is common for all cases. 0, 1, 2, 3, 4, 5. 4 and 5 indicate childbirth and puerperium. 0 indicates unspecified trimester, 1 indicates first trimester, 2 indicates second trimester and 3 indicates third trimester. So the codes for drug use during pregnancy. Let us see one code. O99.320 indicates drug use complicating pregnancy unspecified trimester. Whereas O99.322 indicates drug use complicating pregnancy second trimester. Sixth character to indicate second trimester. Whereas O99.323, the sixth character 3 indicates third trimester. Drug use complicating pregnancy, third trimester. Whereas sixth character 4 indicates childbirth. Drug use complicating pregnancy. O99.324 indicates drug use complicating childbirth. And O99.325 indicates drug use complicating the puerperium. So if you just look at the sixth character, that would be appropriate. O99.31 indicates alcohol use, O99.32 indicates drug use, and O99.33 indicates tobacco use. Sixth character is same, depending upon the trimester, whether it is affecting childbirth or puerperium. Now coming to tobacco use during pregnancy, childbirth and puerperium. That is given by O99.33 subcategory. So O99.330 indicates smoking complicating pregnancy unspecified trimester. O99.331 indicates smoking complicating first trimester. O99.332 indicates smoking complicating second trimester. O99.333 indicates smoking complicating third trimester. O99.334 indicates smoking complicating childbirth, and O99.335 indicates smoking complicating the puerperium. Now let us say an example. A 22-year-old pregnant woman in her 10th week. A 22-year-old pregnant woman in her 10th week presents for routine prenatal visit, whereas the social history of the patient indicates chronic everyday smoker. And patient was not aware she was pregnant until the last week. She was advised by the physician to quit smoking and counseled on smoking cessation. Here the woman is in her 10th week and the pregnancy is complicated by smoking. So the appropriate code is O99.331, O99.331. Smoking in brackets tobacco complicating pregnancy first trimester. 10 weeks means first trimester. Additionally, secondary code from F17 series, F17.210 to indicate nicotine dependence, cigarettes, uncomplicated, followed by weeks of gestation, Z3A.10 to indicate 10 weeks of gestation of pregnancy. So these are the three codes that are essential to indicate tobacco use during pregnancy for this example. Now coming to poisoning, toxic effects and adverse effects and underdosing in a pregnant woman. Coming to poisoning, toxic effects, adverse effects and underdosing in a pregnant woman. A code from the subcategory O9A.2, O9A series. So a code from the subcategory O9A.2, injury, poisoning and certain other consequences of external causes complicating pregnancy, childbirth and puerperium should be sequenced first, followed by appropriate injury, poisoning, toxic effect, adverse effect or underdosing code. And then the additional code that specifies the condition caused by poisoning, toxic effects or adverse effects or underdosing. First, the PDX should be O9A.2 series. Then appropriate injury code or poisoning code or toxic effect code or adverse effect code, and then additionally the condition that caused by poisoning, toxic effect, adverse effect or underdosing. Three codes are essential to indicate poisoning, toxic effects, adverse effects and underdosing in a pregnant woman. So we have seen here it is given by 9A.2. So here we will briefly discuss what are the subcategories of 9A code category. 9A.1 indicates malignant neoplasm complicating pregnancy, childbirth and puerperium. 9A.1, this is further expandable. 9A.2 indicates injury and poisoning and other external causes complicating pregnancy, childbirth and puerperium. 9A.3 indicates physical abuse complicating pregnancy. We will discuss the physical abuse, sexual abuse and psychological abuse codes here only. So 9A.3 indicates physical abuse, 9A.4 indicates sexual abuse, 9A.5 indicates psychological abuse. They all come under 9A category. So first we'll discuss about 9A.2. So 9A.211, the fourth character 1. Here in all the 9A categories, the fifth character 1 indicates pregnancy, fifth character 2 indicates childbirth and fifth character 3 indicates puerperium. That is common. Fifth character 1. If you count 1, 2, 3, 4, 5. Here the fifth character 1 indicates pregnancy. Fifth character 2 indicates childbirth and fifth character 2 indicates childbirth, fifth character 3 indicates puerperium. And the sixth character 1 indicates first trimester, sixth character 2 indicates second trimester, sixth character 3 indicates third trimester, 9 indicates unspecified trimester. So the codes for injury, poisoning, complicating pregnancy, childbirth and puerperium are O9A.211. This indicates injury, poisoning and certain other consequences of external causes complicating pregnancy, first trimester. O9A.212 indicates second trimester. O9A.213 indicates third trimester. O9A.219 indicates unspecified trimester. And O9A.22 indicates injury, poisoning and certain other consequences of external causes complicating childbirth. And O9A.23 indicates complicating puerperium. This is common for all the subcategories of 9A category. Now coming to next category, that is abuse in pregnant women or pregnant patient. For suspected or confirmed cases of abuse of a pregnant patient, a code from the subcategory O9A.3 to indicate physical abuse, O9A.4 to indicate sexual abuse, and O9A.5 to indicate psychological abuse complicating pregnancy, childbirth and puerperium should be sequenced first. PDX should be from either of the category O9A.3, 4 or 5, followed by appropriate codes if applicable. Appropriate codes if applicable to identify any associated current injury due to physical abuse, sexual abuse and the perpetrator of abuse. So these are the additional codes if applicable. PDX should be from O9A.3, 4 or 5 depending upon the type of abuse. Now coming to physical abuse, codes for physical abuse complicating pregnancy, childbirth and puerperium. It is given by O9A.3. So O9A.311 indicates physical abuse complicating pregnancy, first trimester. O9A.312 indicates physical abuse complicating second trimester. O9A.313 indicates physical abuse complicating third trimester. O9A.319 indicates physical abuse complicating unspecified trimester. And O9A.32 indicates physical abuse complicating childbirth and O9A.33 indicates physical abuse complicating the puerperium. Next, O9A.4 series, it deals with sexual abuse complicating pregnancy, childbirth and puerperium. 411, O9A.411 indicates sexual abuse complicating pregnancy, first trimester. 412 indicates sexual abuse complicating second trimester. 413 indicates sexual abuse complicating third trimester. 419 indicates sexual abuse complicating unspecified trimester. And O9A.42 indicates sexual abuse complicating childbirth and O9A.43 indicates sexual abuse complicating the puerperium. Finally, coming to psychological abuse complicating pregnancy, childbirth and puerperium. O9A.5. It is given by the subcategory O9A.5. O9A.511 indicates psychological abuse complicating pregnancy first trimester. O9A.512 indicates psychological abuse complicating pregnancy second trimester. 513 indicates psychological abuse complicating pregnancy third trimester. O9A.519 indicates psychological abuse complicating pregnancy unspecified trimester. And O9A.52 indicates psychological abuse complicating childbirth, and O9A.53 indicates psychological abuse complicating the puerperium. These are the various codes of abuse in pregnant women. Now let us see the overall abuse codes. Abuse in pregnancy is categorized by physical abuse, sexual abuse and psychological abuse. Physical abuse is given by the subcategory O9A.3, whereas sexual abuse is given by the subcategory O9A.4 and psychological abuse is given by the subcategory O9A.5. In all these three cases, there is some commonality between the fifth character and the sixth character. The fifth character, 1. For example, I am taking example of O9A.3 series. It is common for O9A.4 and 5. O9A.31, the fifth character 1 indicates pregnancy. This is further expandable. And fifth character 2 indicates childbirth, whereas fifth character 3 indicates puerperium. Now coming to the sixth character indicates the trimester. Sixth character 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester and 9 indicates unspecified trimester. This is common for O9A.4 and 5 also. Now let us see an example. A 26-year-old pregnant woman in her 30th week complains of psychological abuse by her male partner. She is in the third trimester. So the first code is O9A.513. Psychological abuse complicating pregnancy third trimester. Followed by additional code for perpetrator. The perpetrator is male partner. So Y07.03 male partner perpetrator of maltreatment and neglect. Additionally, weeks of gestation Z3A.30 to indicate 30 weeks of gestation of pregnancy. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.